Hello students, today we will talk about urinary tract infection in children. Urinary tract infection is inflammatory process in urinary tract without indication of infection level. So UTI involve big group of disease caused by microbial invasion into urinary system. Urinary tract infection we divide to two types, uncomplicated UTI of lower UTI and complicated UTI of upper urinary tract. First one include cystitis, urethritis, and urethral syndrome. Complicated UTI of upper urinary tract include pyelonephritis, abscesses, or kidney carbuncle. Let's see about classification of pyelonephritis. Pyelonephritis forms would be primary, secondary, and chronic pyelonephritis. Primary or non-obstructive pyelonephritis would be acute and chronic. So, acute pyelonephritis periods would be active phase, regressive period, and inactive phase. And acute pyelonephritis by kidney function, we divide preserved kidney function impairment, and acute kidney failure. Then, chronic pyelonephritis, we divide the recurrent and latent, and by periods, chronic pyelonephritis would be exacerbation period, partial clinical laboratory remission, and full clinical laboratory remission. By kidney function, we divide preserved kidney function impairment, and chronic kidney failure. So what is the risk factors of UTI? First of all, pyelonephritis in pregnant women, then chronic infectious focuses, especially urogenital in mothers, inflammatory disease of girls like vulvitis, vulvovaginitis, inherited predisposition for kidney disease, metabolic disorder in parents and relatives, and etc. Main ways of infection in UTI, this is hematogenic, urinogenic, and lymphogenic. Predisposing factors can be vesico-ureteric reflux, obstructive uropathy, neurogenic bladder, trauma of lumbosacral region, malnutrition, and immunosuppressive therapy. Main diagnostic criteria of UTI in children. So, for urethritis, it would be pains before urination. In cystitis, it would be pains in the end of urination. In the urethritis would be imperative urination. In the cystitis would be dysuria. So neutrophil-urea and leukocyturia would be more than 50%, and frequent urination, discharges from urethra, bacteriuria. In cystitis would be pains in abdomen, suprapubic area after bladder filling, absence of intoxication, bacteriuria, neutrophil-urea, and terminal hematuria. So pyelonephritis. Intoxicative syndrome would be, fever would be more than 38 degrees, painful syndrome like lumbar pains, pains around umbilicus, dysuria syndrome, especially it would be in lower urinary tract infection, and urine syndrome include bacteriuria, neutrophil-urea, leukocyturia, proteinuria, but less than 1 gram liter. And a little bit erythrocyturia. Clinical features of pyelonephritis in infants and toddlers would be fever, flaccidity, irritation, can start with neurotoxicosis or intestine syndrome, anxiety during urination, crying and irrigation before urination, redness of face, and periorbital edema. Pyelonephritis in school children or adolescents would be fever, headache, flaccidity, fatigability, shadows around eyes, abdomen pains, ureter projection pains, deportment positive symptom, and dysuria. Now you can see here diagnostic methods of UTI. It would be ultrasound examination of the kidneys and bladder, radionuclide rentgenography, excretory urography, mixture cystography, and cystoscopy. UTI treatment include, first of all, regimen, For period of intoxication in strict bed 1, diet, special diet number 5, and diet number 7. Etiatropic therapy like antibiotics, pathogenic therapy, which include glucose and non-steroid anti-inflammation drugs and etc. Like urine antiseptics. Rational antibiotic treatment. This is antibiotic choice is performed according to causative bacteria sensibility. Dosage and regimes of antibiotics must be prescribed according to pharmacokinetics of medication, and antibiotics change or correction must be prompt if previous one is clinically ineffective. Empiric start antibiotics therapy of acute cystitis would be first line. We can use amoxiclav augmentin or nitrofuran medication as furagin furamag. For reserve medication, we can use cephalosporins or cotrimoxazole drugs. Urine examination must be performed 2-3 weeks later after intercurrent disease, when child needs official registration to some establishments before surgery, not less than twice per year to all children.